Meanwhile, Dr. Vimi, once shortest break के बाद एक बार फिर हम आपसे जुड़ गए हैं. Anything else when it comes to skin related issues जिसके लिए लोग आते हैं, या आपने सुना है लोग डरते हैं डॉक्टर विमी, ख़ास तौर पे ये सोच कर के we have to have so many medicines and पता नहीं वो इशू हल हो गया या नहीं, because teenagers में देखा है कि एक्ने का सिलसिला जो है both boys and girls वो हो जाता है. एंड आपको पता है कि the times we are living in, your physical presence, people want to feel confident. This sometimes spoils the whole cycle. What would you like to say on that?
So acne, I would say that it's a very common condition that I see in my everyday practice. So we have to aggressively treat the acne. There is very effective medications right now, in the form of creams. If you have a very severe acne, you have tablets, creams, or like raw Accutane. There is a vitamin A supplement, vitamin A capsules, which is very effective. It's like a dramatic change that you see for those very severe acne.
Is it?
Yeah. So you have to aggressively treat it. But after treating those big pimples, then you leave marks on your face, you have those deep depressed scars. There is no role for creams or tablets. You have to go in for treatments. When you have those black spots on your face, you can do chemical peeling, you can do mesotherapy, PRP, that will improve that spots on your face. When you have those deep depressed scars, you can go for different type of lasers, microneedling, radio frequency. There are different technologies out there which will improve the scars. And always my patients will ask me, which is the best treatment for acne scars? I would always tell them, you have to do a combination treatment. It's not only a single treatment that works, it's a combination treatment, and you go in for multiple treatments to get that desired results.
And approximately, of course it's case to case, but Dr. Vimi, how much time does it take? Because I'm sure today's teenagers, we've been teenagers as well, we never had that patience. I'm not sure in today's times how it is, but any approximate time frame that it would get better, if not completely cured?
So teenage acne, usually it starts in the teens, early teens at 13, and then usually it will stop by 18 or 20. But there is another common condition where you develop acne after the teenage. It's a hormonal acne because of our lifestyle changes. You develop this PCOD. PCOD is a very common condition among young females now. They develop, even though if they have this pubertal acne, it will persist if you have some hormonal issues like that, where you develop mostly pimples on the jawline, and it will be very resistant to treatment. So the normal modality of treatment will not work there. You have to have a lifestyle modification, reduce your weight, eating exercise, eating habits, less of stuff. So that is very important in that case. So this is, of course, acne being the most popular. Anything else that you see usually people approaching you with? Because I have in mind that at times, for aesthetic appearance, there are moles at times, Dr. Vimi, that people want it to be removed. Is there a cure for that as well? And exactly. We can do mole excisions, like small moles can be excised. You have to. Sometimes if any doubtful cases, if there is any malignant potential, you have to take a biopsy and then see after removing also to confirm that nothing serious about it. And then I would say, like, anti-aging, I didn't say anything about anti-aging. Is very so wrinkle. That's why. That is again a common condition that
very popular.
Very popular. So that's what,
for
apart
both
from
men and women,
for men and women, for wrinkles, for sagging, that is a new trend in Dubai. And then in this COVID era, there is more demand for it. Like, can you guess what could be the reason for that?
More demand for it because
more people are looking for it, like for to look younger, for the youthful glow on the skin. So
they want to look younger or more younger?
More younger. To have a blemishless or a youthful glow on the face.
Is it possible, Dr. Vimi?
With the treatments, definitely. Like, that's what I'm saying. Like, take care of the skin properly and then go in for safe treatments. Definitely. And then if you have wrinkles, sagging of the face, you can do Botox, you can do fillers. So,
and a quick question here, Irshad ne humse pucha, what's the best pH required for our skin? Is it also same when it comes to face and hands, Dr. Vimi?
Yeah, so the skin in general, I would say, like, it should be the same, 4 to 5. Yeah, pH should be the the ideal.
But how would we know, Dr. Vimi, that हमारा pH balance
so
है
no,
या हमारा तो तवाज़ुन नहीं पता चलता mental के वो balance है ही नहीं, तो ये pH balance कैसे है, Dr. Vimi?
So it's not like that. Like when you are not using a proper cleanser, your skin goes red and you have flaking, you have redness. So from there you come to know that you are not using the right product.
So basically it's not that कि उन्होंने सुबह मुंह नहीं धोया, it's just the pH balance that has been disturbed.
Yeah, exactly. So when there is any irritation with the cleanser, you have to change. You have to suit the right cleanser for your skin. So in that way you can find out. Yeah, going for like I always ask the patients not to wash their face with harsh bar soaps. Shouldn't be using it.
Like
only
धोते हैं.
Yeah, so yeah, even face.
Sometimes people do.
So only face cleansers should be used, like the liquid face cleansers. So that will be ideal. So there your pH will be maintained.
And can we sleep with makeup and wake up as beautiful as
no, like as no. Yeah. So but people nowadays are very lazy that they do it and they land up with those comedonal acne. The pores will get clogged and then you'll get acneiform eruptions on the face.
And also, Dr. Vimi, what about whiteheads and blackheads? Usually on nose, but otherwise as well.
So whiteheads and blackheads are the beginning lesion of an acne. Sometimes it will persist like that underneath the skin. You can see a roughness underneath the skin. So ideally, like you have to get it removed. So we will give some, comedolytic creams to apply first.
Okay, creams
so
are
to
more
loosen. Yeah. So, but most of the cases you have to get it removed. Comedone extraction has to be done, but don't go to a like parlor where they do it very aggressively. If you do it very aggressively, then I have seen many patients coming up with pigmentation and acne scars following that comedone extraction that they done from the parlors. So you have to go to a good center, go to a dermatologist to get it treated.
Very difficult question I'm going to ask you, Dr. Vimi.
Okay.
Around the world, women would like to know. I'm not really sure about men. ये open pores का क्या करें, Dr. Vimi? How can we? Is there any magic that
So there is no 100% cure for open pores.
Not even,
So some they are born with that. Those who have a oily skin, they are born with the pores little more evident. So their oil reducing cream, salicylic acid creams are there, face washes, or going for salicylic peels and all can reduce the pores to some extent and reduce the oiliness on the skin. But as you grow older, the skin goes loose, and then those who have small pores also, it will go very evident. So in that case, tightening treatments, face lifting treatments will improve the tightening.
Texture,
the tightening of the skin, and then the pores also will get reduced.
They will get reduced, still not much done, but yes, it will get better. And at the same time, the discoloration of skin, Dr. Vimi, हमारे listeners भी, of course, they can join us. ये सारे सवाल जो अक्सर मेरे आसपास होते हैं, I'm asking that, but you're more than welcome to participate because very less time remaining. 0586861003. If you have just joined us, we'll let you know that a traffic update. I'm sure many might be looking forward to it. And जी नाम लिया और Muriel हाजिर हो गई. क्या बात है? Long life, Muriel, that you have. But we'll see how is life on the roads. We're going to do that right now. And Dr. Vimi, right after that, we'll continue with more questions right here. Dr. Vimi from MedStar in Talk Breakfast. But right now, traffic update.
This is Talk 100.3, the Health Hour. Brought to you by
don't forget to ask the advice. The advice, I removed that part and I play, right? But the advice. Yeah. So, advice,
traditional surgeries में you use to cut the pile mask.
What would you like to say? Because she has that, she needs to read a chart.
Okay, so I asked her what advice
would you like to give?
Extremely painful because I see
So I need
I'll ask that in the end.
बैठने में तकलीफ
अभी पूछ रहे हैं.
bleeding रहता है.
अच्छा अभी because मुझे भागने लगे वो तो ITP.
There is no cutting or stitching or anything.
Advice you like to give
Just
patients?
use laser to burn the pile mass so it shrinks over a period
Sounds
of
like
time.
you
So
know.
3 to 4 weeks में shrink हो जाता है.
Why is he
Up and
speaking?
down time नहीं. Patient is up and down.
I think it's him.
In fact,
Yeah.
so many of my patients are after the anesthesia, they get up from anesthesia and they go home, they walk, they drive.
The Health Hour, brought to you by MedStar Multi-Speciality Centre. This is Talk 100.3.
BBC and
Talk 100.3, traffic.
10:26 on the clock. Good morning. This is Muriel with the traffic update. Well, if you're headed towards Sharjah, traffic slowing down around Green Belt Ladies Park. If you're headed that way, there's a delay of about 5 minutes on that route. Also, traffic slowing down towards Tumbe Hospital in Ajman. This is E11. Headed all the way towards city centre Ajman. Traffic slowing down in and around Sharjah. Sharjah Cricket Stadium is looking busier than usual. If you're headed towards Dar Al Khalij or even Al Majaz in Sharjah, heavy traffic on that route. Safir Mall right up to Ansar Mall is looking a bit clogged than usual. Also, traffic slowing down near Lulu Hypermarket Al Gisez. This is headed all the way towards Al Mullah Plaza with delays of about 5 to 7 minutes on that route. City centre there are looking busier than usual. This is D85. If you headed down from Dera Clock Tower towards city centre, that is in Dera. Heavy traffic in and around the Consulate General of Pakistan. This is in Al Karama, Bardubai in fact. Heavy traffic around there. D88 in Karama is also experiencing delay of about 5 to 7 minutes. Now if you headed down towards Al Fahidi, this is D92, D79. Heavy traffic on that route. Be aware you'd be in for a slow moving traffic for about 4 to 5 minutes. Also, busy area has been noted around the Dubai Frame. This is Dubai Garden Glow and Dubai Frame intersection, causing a delay of about 12 minutes on that road. DIFC completely choco-blocked this very minute, so please be aware. If you're headed on that route, you'd be in for a delay of about 9 to 12 minutes. The Green Planet, if you're headed towards City Walk, even heavy traffic on that route. Traffic slowing down near Mercato Mall as well. Traffic moving really slowly near Dubai Water Canal. Safa Park is also experiencing a delay of about 4 to 5 minutes. If you're headed towards Oli, this is in Al Quoz. Traffic slowing down, causing a delay of about 5 to 7 minutes. First Al Khail Street is also experiencing delay. There has been an accident that has just been reported on E44. This is Russell Khor Road, Al Khail Road, causing a delay of about 13 minutes on that route. Traffic moving really slowly around Mall of the Emirates as well. Top Golf experiencing delays of about 5 minutes. Jumeirah Golf Estate Clubhouse, if you headed that way, this is all the way from Dubai Sports City. There's a delay of about 6 minutes on that route. Well, if you're stuck on any other route, please feel free to drop us a message and let us know where exactly you are, and we'll be more than happy to take you up on air.
UAE's conversation starts here. Talk Breakfast with Vivek Sunil and Sobia Khan
Advice, huh?
on Talk 100.3.
Thank you so much for that detailed traffic update, Muriel. And now quickly continuing with Dr. Vimi. Very little time, Dr. Vimi, welcome back once again. And would like to know that in general, what advice would you like to share with our listeners? Men, women, teenagers, children, of course, because it's easy to create habits at that age. So would love to know that.
So whenever you have a problem, like you have to go to a dermatologist. Don't go with from over-the-counter medication.
Okay.
That is not advisable, especially for whitening and all. Nowadays there is a trend of putting like potent steroid containing creams which immediate glow. They are marketing like that, but I've seen very serious side effects like the thinning of the skin, wrinkles and whatnot. Such things shouldn't be entertained. And looking good, naturally looking
Food
good is the
intake
trend.
that you encourage, eating or drinking?
Eating, so
water
acne,
drinking, H2O.
water, As you all know, you have to drink 6 to 8 glasses of water.
6 to 8 any age, and if you're outdoors.
Yeah, so now they say if you don't over hydrate also, that is also not advisable. So but you have to maintain at least 1 to 1.5 liters of water daily. That skin being the largest organ of your body, you can see the wrinkles and the dryness.
That even our mind is
so you should hydrate your skin properly by drinking water. And more important, when you have dryness of the skin, you can put moisturizing lotions immediately after bath that you apply it.
Immediately after bath.
So just mop that excess water and then immediately you put the moisturizing lotion on the face as well as the body, so that you will lock in that moisturizer. That's how you use a moisturizing cream.
Fantastic.
Yeah.
For women, we have this you can say the luxury of using the base or the foundation to improve the discoloration of skin.
Yeah.
But I'm sure you must have received cases where even in men you see the discoloration of skin, especially on the face. What it's about, and is there any way out?
So discoloration of the skin can be due to various causes. Like you have to see what exactly is the problem and then you have to treat accordingly. any kind of pigmentation, sun exposure will aggravate it. Like, no, so you have to use any pigmentation for that matter. You have to use a good sunscreen. Sun protective cream is a must for pigmentation problems. And then depending upon the problem, we have different types of treatments also, along with the creams that we'll advise. We have like treatments like chemical peel, mesotherapy, CO2 lace. There are different treatments that can be done depending upon what kind of a problem. Like, no, it's for a layman, it's only a spot on the face, a black pigmentation, a black mark on the face. But for a dermatologist, it's a myriad of problems that can cause this kind of pigmentation. So
Fantastic.
according to the concern that you have to treat it. So you have to go to a good dermatologist, a good doctor
like Dr. Vimi, because anything that we...
So who is well versed in doing all this cosmetic procedures. Don't go away with the cheap products or services, like, no,
because you have to
so after all, your face is at stake, no, so
Indeed.
you have to take care of it properly and have a good diet and a healthy lifestyle and a good skincare routine to follow.
Nothing can be a substitute
will
for
take
that.
a long way for a healthy and a glowing skin.
And Dr. Vimi, how can we get in touch with you at MedStar? Do you have certain days? You are 5 days a week?
Yeah. So I'm 3 days a week.
3 days a week.
Yeah, Saturday, Monday, Wednesday, 10 to 1 I'm there.
Okay, Saturday. So on weekends, people...
Yeah, so Saturday everybody can come and
Yes.
meet me, like, and Mondays and Wednesdays.
Mondays and Wednesdays.
Yeah.
Of course, so that's MedStar.
Yes.
Dr. Vimi,
Yes.
so many questions we threw at you and aapne bakhoobi uska jawab diya. Thank you once
Thank
again.
you.
And I'm sure people would love to see you because you have a solution for every problem.
Thank you.
Thank you once again.
Yeah.
So that's Dr. Vimi jo hamare sath judi.